Hello, this is Doris Vick with MedAdvantage Resources and welcome to Coding Skin Grafts CPT Code Surgical based on the anatomy of the skin. I'd like to begin with asking one simple question. Do you know how to use the American Medical Association CPT Professional Edition to code surgical procedures anatomically? Consider this. Surgeons specialize in performance of surgical procedures within an anatomical body system. This same logic applies to the structure of the CPT coding manuals. The anatomical structure of the skin consists of numerous components. It is one organ within the integumentary system. Coding of the integumentary system is somewhat different than coding of other body systems. Let's begin by reviewing the following illustration for anatomical terminology for the surgical components of the layers of the skin. Pause the recording or replay, become familiar with this particular illustration. It shows you the different components of the layers of skin. It also, in this illustration, has the other components within the integumentary system also, such as the hair. The very top layer is epidermis. The true skin is referred to as the dermis, therefore epidermis would be epi is a bone, therefore it's upon the dermal layer of the skin. Subcutaneous, the root word in subcutaneous, cutaneous means skin, so it's below the true level or the dermis of the skin, hence the subcutaneous. It is also, as illustrated in the picture on your screen, to be a fatty type of tissue. You also see in this illustration veins, arteries, nerve endings, different components that do not belong within the integumentary system but are vital to the life and healthy skin. Here is a different illustration from a different view, also different terminology. It divides the layers even into more detail. Again, pause the recording as necessary, replay, become familiar with the terminology for the anatomy of the skin or integumentary system. Accurate code assignment requires knowledge of the anatomy of the integumentary system. You can't begin to code accurately without being familiar with the different terms. These terms will be used by the surgeons in the surgical narrative or the operative report. Become familiar with the meaning, the definition of stratum, and then epidermis, and then the different layers within the epidermis, as in the illustration, and then the true skin or the dermis layer. Accurate coding assignment also requires even deeper anatomy knowledge of integumentary. You need to become familiar with reference to the thickness or the layers, for instance, full thickness, split thickness, the dermal layer, pinch, split, epidermal. All of these are terms that you will find in the surgical coding description and also in the surgeon's reporting of the procedure. Also become familiar what the definition of a surgical prep is. This is not prepping for a surgical sterile field. This is preparing the skin to receive a graft. There are detailed instructions and definitions in the CPT coding manual addressing surgical preparation. Also an autograft or cultured autografts. The prefix auto tells you exactly that it is coming from the patient themselves. It is their own skin that is being grafted, and many times they culture or grow for a later graft. Autografts. Skin substitutes, grafts are non-autografts. These are not coming from the patient as the donor. They're coming from skin banks or also artificial skin substitutes. I'd like for you to turn to the table of contents in the CPT Professional Edition. Locate the surgical graft procedures for the anatomical area of the skin. You will find that the skin replacement codes range 15002 through 15278. Take a look at these and also reference the coding section that gives the description by the code. Many times also there are instructions and specific guidelines for that particular code range. Skin flaps, these are skin or deep tissues, muscles, tendons, a lot of things you'll find within those that are in the grafting area. The code range for these flaps are 15570 through 15738. Again, explore the descriptions in the codes. Then you'll find a section as other grafts or other flaps and grafts. 15740 or 15761. That is a typo. Please correct. There are numerous detailed surgical procedures performed on anatomical skin structures. I would like for you to review and compare code descriptions 15120 and 15240. In looking at these particular codes, pay attention to the level or the level of the skin graft. These are all skin graftings. You will find that 1520, a specific definition that will give you the area of the graft, such as face, scalp, eyelids, mouth, neck, ears, and orbits, genitals. It also includes the hands, the feet. You'll note at the beginning of that description, it refers to as split thickness. Now let's look at 15240. 15240 begins with a description of full thickness graft. It's a free graft. It also gives you the location of the site of the graft. There's lots of details. It gives you an area. It also gives you an add-on code for the additionals, square centimeters. Do reference your description, pay particular attention, review the entire section for the differences in the code ranges and the descriptions. Your job as a coder or coding specialist would be to accurately report the surgeon's work performed and documented in the narrative report or the operative report with the appropriate code application or assignment, including any modifiers. Modifiers, remember, you'll find in the appendix towards the back of the CPT Professional Edition. Now let's continue. Let's review and compare code descriptions for 15570 and 15600. As noted in these, you will find uniqueness and differences. 15570 is in a different subsection. It's listed under the blue text for flaps, skin, and deep tissue. There is definitely a difference in coding flaps than there is coding straight, split thickness, full thickness skin grafts. We'd like to continue reviewing the details of the surgical descriptions for the procedures in the skin and the grafting. The key to surgical coding is understanding the structural components of all layers of skin, exactly detailed of what the surgeon is performing, how deep, what area, and where the skin came from, autograft or non-auto. This is the conclusion of the review for grafts for skin for the CPT surgical coding. If you found this information valuable, check out our other blogs on topics. If you're interested in trying a course, You're welcome to register directly from our website. We provided the link for you here. Register now. Regularly, the charge is $100 for the HCPCS coding class. It does include, as all of our courses, mentoring, direct support with me, the instructor, whenever you need for answering your questions and clarification. So thank you for joining. Look for our other blog information.